If something sounds too good to be true, it usually is. That's the same for hip surgery as it is in most things in life. Keep watching and I'll give you some top trade tips to help you choose the right surgeon and the right hip replacement for you. Hello, I'm Jeremy Latham, I'm the hip surgeon. When you get on a plane to go on a holiday or a business trip, you don't really care who the flight crew is. You know that they're highly trained, tightly regulated, the plane is serviced regularly, and everything's in place to make sure that you're safe and that you'll get to your destination at the right time. Why can't it be like this when you sign up for a hip replacement? It is in the NHS. If you have a hip replacement in the NHS, you know that the surgeon has been through a training programme, they're registered with the General Medical Council, the hospital is regulated and all the nursing staff are highly trained. But you don't get to choose who the surgeon is or what type of hip replacement that you have done. It's different in the private sector. If you're lucky enough to have private health insurance or you can pay for the operation yourself, you get to choose who does the operation for you at the hospital that you want to go to and at a time of your choosing. This is when it gets very difficult. If you Google hip replacement surgeons, you'll get thousands of entries from surgeons advertising all sorts of different treatments that might be able to help you. So how do you choose? How do you differentiate between them? The best thing to do, I think, is to ask your friends and family. If you're having hip replacement surgery, it's likely that you know people who've been through the operation already. How did they rate their surgeon? Did the team support them well? Were there any problems, and if so, how were they dealt with? These issues are often critical when it comes to evaluating how genuine a surgeon is and what his values are. These are really important factors when you want to make a critical decision about something that affects your life so dramatically. Here's another top trade secret. If somebody's offering a brand new treatment, maybe doing the hip replacement through the front, so-called direct anterior approach, or offering stem cell treatment, ask them why have they chosen this particular treatment and why is it suitable for you? Have they been doing something different for all these years before they've decided to change to a different approach to the hip? If so, what problem were they trying to solve? One of the things about surgeons is that we're very conservative, small c conservative. We like to do the same thing time and time again. Of course, we vary our technique depending on what the problem is we're trying to overcome. If that surgeon's explanation seems plausible and genuine, that's fair enough. But if you've got any doubts, my advice is walk away. Find somebody else that you can relate to who has a genuine explanation as to why they offer that treatment for you and why it's the perfect thing for you under all the circumstances. One of the best things about being a surgeon who's been around the block a few times like me is that I know exactly what works for my patients. I know which implants are the right ones for you, what techniques are the best. I've been there, I've done it all. I know which surgeon I'd go to if I needed a hip replacement or if one of my friends or family did. These surgeons share my values. If you want advice about your hip, please get in touch, either by email, on the phone or through my website. The details are given below. Even if I don't do your surgery, I can offer you advice about all aspects of hip problems. I'm here to help. I can help you make the right choices. See you next time. If you like this channel, please subscribe. If you've got any comments or questions, please get in touch. Thanks for watching. I'm Jeremy Latham and I'm the hip surgeon.